Sexual history was just something I was taught in medical school, and not all medical schools teach how to do a good sexual history. A lot of doctors are too shy and dance around the subject and only kind of bumble themselves into it eventually. There's a lot of data suggesting most doctors go in and say, okay, and how's your husband? And like that assumption, even the person may be gay, and then they get turned off. We were taught specifically how to be open-minded about that, but also in my medical school, it was a combined BS-MD program, and they got us to do some medical stuff early on. They threw us in the deep end of the pool, and they said, you're going to interview people who don't have vanilla sex lives, and you're going to be graded for it. All of us people just coming out of high school, working so hard to get A's and trying to get into med school, achieve. We're like naive Midwesterners, probably mostly sexually inexperienced people, and all of a sudden we're having to perform by asking questions, receiving in gentle manner, and be able to have people open up and share stuff that they don't know if they trust you and stuff like that. That's what I meant by it was a little different. My couple was swingers and participated in orgies, and I hadn't met anyone or talked to anyone that had done that before at that point in my life. The idea is get that over with. But also, when we got to medical school, I think the standard sexual education is like, this is the clinical laboratory. We're wearing white coats. Here are the subjects. They're going to lie in the MRI machine while they masturbate, and you will see. Here's a little video scope, and you will see the changes in the vagina lifting and the cervix tightening. And I'm like, what? That is not really what you should be learning. That was the different experiences in how they teach sexual health to doctors in standard medical school versus our program in interviewing. You never know what a doctor has been taught in medical school, but it's probably more likely the clinical stuff. Most doctors have to gain the conversation skills.
When I learned about swingers, it was just a random YouTube video, and they were like in Spain visiting. That was part of their vacation, visiting clubs around Spain. But how was it for you, like learning about that, like in a real time with a person in your face, and you're the doctor, you cannot go like, oh my God.
Yeah, I know, right? Exactly. I went to a Catholic high school. There was a bit of a religious, prohibition about masturbation, anything other than, missionary style sex. And I don't think that they did very much sexual education. They're just like, these are STDs, don't get them. I'm an adaptable person. When I say go off into the deep end, I'm one of those people that, there was a YMCA and they did have a 30-foot diving board, and I was one that says, I'm going to do this. Even as a high schooler, I was going to do this. I'm going to jump off the 30-foot diving board. I had a little bit of a wild life in end of high school, so I didn't necessarily click with the Catholic education way of looking at things. So I felt like I was open-minded enough just to handle it. I had friends who were gay, and so I already was open-minded to that there are ways to do things that aren't vanilla.
How did you get those conversation skills when it came to asking the questions and keeping a poker face when things were new to you?
We spent a lot of time in motivational interviewing in my years. The very first introduction was, they gave us a very canned sentence. You feel this because of this, and you're reflecting back to the person what they just said in maybe slightly different words. That was the very ingrained fallback, just be able to reflect back. So you have a expanded non-monogamous lifestyle. Then boom, you just switch the words around and just gave it back to them what they just said to you. They feel like they were listened to, that they were heard, and that they were valued. That is just the standard. Even if you're stressed, you can manage to come up with that. Even if you're like, whoa, never heard of this before. That also worked well with the veterans coming back from war, and they've had some really horrendous experiences. The one guy said that he was crawling on the ground and there were rivers of blood. I wanted to go, oh my God, but you can't. You have to be that steady person that listens to them and hears them and receives it without freaking out, because that's why they hold it back in. It's because they're afraid that they'll be freaking people out or hurting people just by telling them. Just the different experiences in med school that might be considered traumatic to go through as a doctor, it gives you that tough outer coat or that skill of handling things.
You have done a lot of work with veterans, right?
Oh, yeah. I worked for the VA for 18 years. When the VA was trying to deal with the opioid crisis, they were trying to get people into the pain clinic. The pain clinic had too long of a wait. They were looking for volunteers to handle people's pain at a less expertise level, more like listening to them, making sure they had all the labs, x-rays, and imaging that they needed to have done, making sure that they've gone through physical therapy if it was appropriate, making sure that they're not taking two of the same category of medicine, and hurting their kidneys, making sure that they've tried a variety of prescription medicines and things that people can do, like stretches, yoga, low inflammatory diets, and just different things that you can do from a primary care standpoint. But you need the time to sit down and actually go through this with people. And even a half an hour, which was the standard for VA, double what most people get to go through in primary care, is not quite enough to go through everything that people want to tell their whole pain story. And you have to almost have that to understand exactly what's wrong with them. They gave us an hour with each patient, which was a lovely blessing, let me tell you. We did get to go through a full history. We did get to make sure they had tick all the boxes of ordering, and we did get to listen to them, and that's therapeutic too. We got to problem solve the prescriptions that they were having this side effect from or that side effect from. Some people didn't want prescriptions, and some of them didn't even want to be on the opioids, but they were having trouble with the withdrawal side effects. We got to spend hour after hour with people dealing with chronic pain. That got me interested in all these what I considered side things, alternative medicine or complementary medicine. I started investigating that, started doing a little bit of yoga. I started to read up on pain management and learn about some devices that people could wear for compression or for stretching the neck, for supporting the back, or these devices that use ultrasound, cold or heat, or just all kinds of alternative things that were more Western medicine. And then I started thinking about Eastern medicine. We had the opportunity to learn how to do what the VA called battlefield acupuncture, 5 points on the ear, auricular acupuncture. I signed up for that and eventually became a teacher for that. Really saw a lot of good results from that. And that piqued my interest in Eastern medicine, so that when it was time for me to transition from the VA for personal and growth reasons, then I decided, well, in this in-between period, I could just go into private sector and kind of be a hamster wheel, or I can see if I can find my skills to match the next job. It was hard to find a job where that would be valued unless you went fully through the integrative medicine fellowship, which is a 2-year thing. And then that's 2 years. I thought that maybe financially I didn't want to leave my family 2 years without an income. And then get started and have an unsurety. So as I was continuing to look for work, I was continuing to learn the yoga. I had time on my hands and a busy mind. So yoga and then meditation courses. And then I was like, if I don't have a job by this month, I'm just going to sign up for medical acupuncture, and then that will launch me into a new career. That's exactly what happened. When I came out of that, I also realized there aren't many jobs that even allow medical acupuncture in the hospital. You have to go through committees, you have to get the buy-in, blah, blah, blah. So I'm like, I'm just going to start a practice. And then I learned business while I was waiting to open my practice. Now, here's where I am. My practice is geared toward people who are interested in holistic medicine, kind of a different way to do things than just here, come in, 5 minutes, here's your prescription. They want to use less medicine. They want to get rid of pain. They want to get rid of whatever functional problem is bothering them. And sometimes it's something that Western medicine tells them, oh, it's no big deal, because it's not an official disease. It's not going to kill you, so just deal with it. People don't want to hear that. I wouldn't want to hear that. I didn't want to hear that when I had my problems. So this is an opportunity with direct care. You just pay the doctor directly. You can have pretty much all the time you need. It's concierge. And to have all the time you need, now you can delve into the background, the reason why. What are your stresses in your life? How does this relate to physical problems?
How has your training in acupuncture transformed how you see pain?
I went into it learning about kind of the Western mindset of how does this work? What pathway? Is it the spinal cord? Is it the brain? What pain center in the brain? What lights up on the MRI? What neurotransmitters are involved? And they gave us all that information. And then they sat down and said, now put this needle here in you. And then your partner's like, hey, my headache's gone. And the other partner's like, my backache's gone. You have this intellectual learning experience and you have this lived learning experience. And the lived learning experience is more powerful because it's just something like, that was a problem and now it's gone. And it's just an impressive thing. That helped me open my mind to the Eastern way of looking at the world, which is more waves and energy instead of particles. Western medicine's kind of reductionistic. What's your problem? What's the pathway? What's the enzyme? What's the molecule? It all boils down to a thing, a particle. Eastern medicine a lot of it is more about function, interacting systems, and energy. When we learn things about the yin energy rises from the earth and comes to your more cuddle areas of your body, and the yang energy is the sun shining on the parts of you that usually face away from the sun. You don't stare at it all the time, so it's shining on like the back parts of you, the backs of your arms. The energy is coming from above and it's coming from below and it's circulating, and then that explains how there are meridians and how there's flow of energy through it. Those are concepts. And then you put it in action with the needles. I've gone to the point where, and I don't know how this is, maybe somebody will explain it to me from Reiki or something, but I can feel the energy moving with like a static electricity sort of feel in my fingers now. That's something that developed slowly over a few months. My acupuncturist mentor said, hey, can you feel that yet? And I was like, hey, yeah, what is that about? And he's like, you just start to get that ability to feel it. And I'm like, okay. It's not anything explained in Eastern school, and it wasn't explained in Western school either. They don't say, well, there's people that can feel static electricity better than other people, and nobody has ever studied that, I don't think, except people who are into Reiki, who that's their job, is to feel that, give or receive or manipulate, as best as I understand Reiki.
I think it's a sensibility that you start to develop. And I don't know if you have heard about him from interpersonal neurobiology, Dan Siegel.
Oh yeah, Dan Siegel, yes.
Energy. One of the things that they say with the studies and research is, not because it hasn't been studied, that doesn't mean that doesn't exist. It's just we don't know yet how to measure these things. For me, I wouldn't say that if I touch somebody feel anything, but you can sense when I'm talking to people and they go deep into their emotions, you can feel that in the air. You can feel how the ambience in a room can change. I think that's such a powerful, important thing to do when you're working with somebody, some type of healing. There's something to shift and you can feel that. I don't feel that if I'm just going to a store. And
if you're ever at a concert or a high school play, for example, there's a night when people are on and you can really feel the energy of the crowd. And there's other times it's kind of ho-hum and, you can feel that too. I love to experience that. It's one of my favorite things to do.
Do you feel it has changed the way that you live your life?
Because I have structured my medical practice to be supportive of my whole health. Yes, it definitely has. It has helped me, for one thing, get rid of daily migraines. For another thing, have the time to exercise. When I respect my body's needs and my self-care, I am a better physician. When I didn't respect that, I was just keeping my head above water, distracted all the time, hard to think, had to go back and make sure I didn't make a mistake, having brain fog a lot worse than normal, perimenopause, all that is just from a high stress work environment. Now my work environment's as stressful as I want to make it, which is not very, but you do need to have clients to have an income. So we're working on that.
What are your suggestions for, like you said, building a practice that supports your whole health? I feel like there's always something to do. When you have your own practice, you're always learning something that you didn't know how to build a website, didn't know how to do this and that, and now you're learning all the things, plus seeing clients.
Well, if you build a holistic practice, you're going to be preaching. The best way to look at it is practice what you preach. If you went to the trouble to go through 200 hours of study to learn to be a yoga instructor like me, then you should remember to continue to do yoga. The way I did it is, I could continue to do yoga on the further instruction video thing, which is what I originally learned it from Yoga University. But at the same time, I could build my business by going out to the community and joining local yoga studios and meeting people. I've been doing the yoga in the community and a little bit at home and a little bit structuring it for workshops and things like that. I'm still doing yoga, maybe not as much as an ideal personal yoga practice of every day, but I'm still keeping it in my life. And the same thing for meditation. Right now, I'm trying to learn more hypnosis techniques from a friend. Part of the hypnosis technique is that getting really relaxed in the first place, which is very similar to a formal meditation. There's multiple different ways to get into that state of relaxation prior to the suggestions of hypnosis. Some of them are like the yoga nidra that I learned in yoga school. By practicing my preaching and further learning and connecting all the dots from what I previously learned to what I'm continuing to learn, then it allows me to incorporate that into my business life, even if I don't have the time to do it in my personal life. But lifestyle medicine says social connection is one of the things that you need to do to have a healthy lifestyle and help you with many of the medical problems that can go wrong, especially in mental health. I look at networking as, building social connection. It's doing two things at once. It's supporting my business, but it's also building social connection. For nutrition, I am offering nutrition products for weight loss, for example, or for better macros, for less inflammation. I'm going through the products that I'm willing to sell in office to see, do I like this product? Does it work? Is it doable? Is it too much trouble? Is this for type A people who like to check boxes? Is this for overwhelmed moms who have too many other things to do and they need to keep it simple? We're going through several different dietary plans, but that helps me keep straight. Oh yeah, I've got to eat enough vegetables. Oh, I need to eat enough fruit. Oh, maybe don't have saturated fats. That helps me because I'm doing something for my business to evaluate a nutritional product. I'm doing the nutrition for myself. A lot of times, even if you feel like you don't have enough time and you're building a practice as a physician, you do if you make it part of your business, or if you find a business excuse for doing what you ought to be doing, because a lot of doctors are type A and put their work first and their self-care later. But if you make self-care part of your work, you just have to convince yourself of that, then you have yourself a healthy work lifestyle.
I'm having a tickle because I'm thinking it makes it very obvious when it has too much time has passed for me to have sex. Like, God damn it, it cannot fall in the back of my head.
Yeah, because you're talking about sex all the time. If you're not doing it as much as you want to be doing it, it's like a motivation. Oh yeah, I got to do that.
What do you mean by lifestyle medicine?
Okay, there is something called lifestyle medicine. It is a specialty. You can get board certified in it. There's 7 pillars. Let's see if on demand I can remember all 7 pillars on recording here, but let's go. All right, so there is nutrition. There is sleep. There is movement, like healthy movement, move your body. There is stress management. Don't ask me why there's both stress management and mental health, but they're listed as separate things. I guess maybe one for you don't have a mental health problem, but you do have stress, and the other for you have a mental health problem. Let's optimize it, including speaking to psychologists and counselors. So that's 5. Avoidance of toxins is 6, and healthy connections is 7. That's the 7 pillars. But I argue there ought to be at least 2 more: gut health and sexuality. And then maybe even 1 more, which is family interactions. Being a family medicine doctor, all those are important. But anyway, the first 7 were the official ones. You learn modules, you pass the test, you call yourself certified in lifestyle medicine. That is all from very strongly Western evidence-based. That's the limitation. The good thing and the bad thing about that is that if you practice as a lifestyle medicine physician, what you learned was double-blind, placebo-controlled trials, and they actually spent the time to find them amongst all the nutrition literature out there, as opposed to regular medical school. They don't spend much time, and you just never have a chance to, on your own, go sorting through everything, so you just kind of give up, and you just say, oh, that's not important. But with lifestyle medicine, they collect it together, and they spoon feed you the Western version of double-blind, placebo-controlled studies, which in my mind is limiting because, again, there's a lot of biases out there. There's no funding, hardly any funding for nutrition research, exercise research, and so forth. You're not going to find a lot of double-blind, placebo-controlled studies, but you're going to find a lot of little studies for the people that were interested in it. There's a branch kind of coming off of that, isn't official yet, I don't think, called longevity medicine, and there's lots of courses for it. That's more like biohacking your health, trying to live better, longer, through hormones, through devices. A lot of times, like, let's sleep more ideally, let's wear this little thing, and let's have a sound bed that gives you vibrations, and there's all kinds of interesting things out there. Expensive, typically. I'm eventually going to get into that. It sounds very fascinating. Things like, I don't know if anyone's heard of this, but you have telomeres on your genes, on your chromosomes. When they are longer, you're healthier, you live longer. When they're shorter, it's usually that way if you have poor nutrition, lots of stress, and no exercise. The idea is make those telomeres long. It also helps you express your genes better. It's not just genetic, epigenetic. A lot of that has to do with the lifestyle. It all kind of comes together, lifestyle and longevity medicine. Eastern medicine, as far as general health and sexual health, is a little different because, again, they focus a lot on the energy, and they have some really old-fashioned wisdom coming from 2,000 years ago that they honor, and every 1,000 or so years, somebody challenges it and rewrites the books. There's the Yellow Emperor's Classic of Eastern Medicine, the Neijing. It wasn't really written by the Yellow Emperor or his discussion with his physician, but it's kind of like Aesop's fables. Not all of them were really written by Aesop, but they're all going to give him that name. Not all of David's Psalms were written by David, but they're going to attribute it to him. Not all of Mother Goose's, tales were written by Mother Goose, but they're going to say Mother Goose since it's the Yellow Emperor's medical textbook. And after another 100 to two, hundreds and hundreds of years from master telling apprentice, do not question the master. Finally, somebody questions the master and then rewrites the book. There's a lot of instructions from that, such as you don't want to expend too much energy through too much sex, basically. You want to, if you're going to have sex, then you want to be eating properly. Just some basic stuff. I don't understand why they say don't expend too much energy from sex. I personally like sex and I want to expend energy. But, that was one of their things that I kind of laugh at. And we all laugh at it. We tell people after acupuncture, for this day, because you've had all this energy put into you, no sex, no ice cream, no bamboo shoots, which kind of means we're manipulating your energy. If you do something highly energetic or hard to do energetically, don't overdo it, then that might be taking away from the benefit of the treatment, or it might be too much for you. You'll be exhausted. Who knows? No alcohol also the same day as your acupuncture treatment. So those are standard precautions. People ignore me all the time. But the idea is like trying to digest something super fibrous really puts a strain on your digestive energy system, and maybe having sex right after having your energy washed back and forth and manipulated is maybe a little bit too much expenditure of energy. You might not sleep well or something like that. Some of these grains of wisdom are just passed down, and you don't question them until you question them 1,000 years later. We take that wisdom and we take it with a little grain of salt and blend it with our Western information, and we kind of put everything together.
What does sexual energy mean to you?
Sexual energy, from a Western standpoint, it's like, how people will be exhausted from overscheduling, or the kids threw this and that crisis at you today, and the dinner got burnt, and then the dog's barking. You're all just like, ugh, not tonight. You can drain your energy through the stress of the day and not want to have sex. You can plop on the couch and watch TV and just be lulled into that kind of passive, receptive mode and not want to have sex. To me, Western medicine energy for sex is related to just the general energy you have for the day, whether you're too stressed, whether you're too overscheduled, whether dumb stuff is happening to you at home. It doesn't matter if you love your partner, or generally you're excited about your partner. You can just get drained and not want to do it. Pain can be a terrible drain on sexual energy, or the fear that you're going to have more pain with sex. That's highly draining from an energy standpoint. Now, Eastern medicine, sexual energy has to do with the meridians that flow through the sexual organs, and there are many of them. There are points. One of the greatest points for energy whatsoever in the whole entire body is a point between your breastbone end over here and top over here. You just press along it till you find the most tender area that's trying to say, this is me, I need help here. And that spot, when rubbed, increases your overall energy. So if you're trying to have sex and you don't have as much energy, it might be worthwhile to do some acupressure during sex. And I've tried this myself and I found it to be quite helpful. That's one little aspect of it, but they don't teach you in my acupuncture school, do this spot for sex, other than there's a spot on the ear that's the sexual point. There's the spot in another curve of the ear that's where the sexual organs are represented on the ear. Probably there's the sexual meridian down here. This is where on the hand, where the male organs are here and the female organs are just a little bit above that in the center line of the hand. We know that there's areas that correspond to the sexual organs. There's research that fibroids of the uterus in this whole little square area over here, if you use moxa, which is a lit herbal cigar that radiates red light and infrared at a certain wavelength, that if you regularly treat this area, you can shrink fibroids that are 8 centimeters, which is about 3.5 inches, down to nothing. That's just one little example of how adjusting the energy on your meridians can affect your sexual organs. That's about the limits of what I've learned from Eastern and Western, how it affects energy for sex. For example, the liver meridian has a branch that goes to the sexual organs. The kidney meridian has a branch that goes to the frontal part of the spinal cord, of which there's nerves that go to the sexual organs. We call it Renmo meridian. It's one that starts, below the fourchette for women. That's a fancy term for below the hole of the vagina, and transfers up and goes to your bottom lip. Then there's another one called Dumo that starts on the back side of the anus and goes up the back of you and ends on the upper lip. Those two connect with each other. They come from a source of energy, dive down into the pelvic organs, and split up and come up and around and meet each other over here. When people meditate, they're taught to meditate in yoga with sticking your tongue up against the roof of your mouth. You're at that point connecting this meridian, which ends here, with this meridian that ends there. If you stick your tongue up to the roof of your mouth when you're inhaling and exhaling, you're connecting that meridian system and you're allowing a circular flow, which is kind of cool.
Technically, we can say that the whole body is an erogenous zone, really.
Yeah, the whole body. Most meridians go through the sexual organs. I'm trying to think of one that might not is the gallbladder meridian. It goes zigzag on the side of the body. It's mostly concerned with muscles and movement and not so much concerned with your spine or your interior organs, except the liver and the gallbladder. Those are off to the side anyway, on one side and the other side, mostly on the right side. But the energy from the liver and the gallbladder is on both sides. It's kind of an interesting way that they just decided to call it that, even though our Western medicine says, but the gallbladder and the liver is just on the right side. So why are you having a gallbladder liver meridian on the left side? Arbitrary, I guess, to be symmetric.
Make it look pretty. How do you help people with chronic pain in general, and specifically people who have chronic pain?
That's a challenge. First of all, I encourage people to be very open-minded about the different positions that they use. That's kind of a no-brainer. Secondly, I encourage people to use masturbation, including mutual masturbation, because most people can find a comfortable place to be. If they're wanting to share intimacy and have an orgasm and they want their partner to feel intimate with them and have an orgasm, then that can be achieved through two people doing mutual masturbation at the same time. And comfortably for the person involved, because the person involved that has pain doesn't always want to say ouch, 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 because pretty soon the person that's trying to be sexual with them is like backing, oh, I don't want to hurt you, and then that just disturbs the whole thing. A lot of times the people that are in pain will just hold it in and not say anything. You're starting to build up the excitement phase, and then it drops down again, and then you have to have more time building up an excitement phase, and it drops down again, and so it just takes a lot longer. Guys should understand that women have a long excitement phase sometimes anyway, and longer often than they want to participate in pre-sex, but especially so if a woman is having pain, they may have to have an extra long, and women are used to guys not having a long excitement phase, and they need to open their minds and understand that when you're in pain, you might have, erection, up, it went away, erection, up, it went away. People need to have a lot of patience with each other when you're going to have sex with chronic pain. Getting the skills to do meditation is very important if you have chronic pain, because then you can kind of learn to, there's certain things that pop up that you just learn to let slide out of your mind instead of obsess about. That's a skill that you learn over and over and over again with meditation. You're focusing on your breathing, and then all of a sudden, oh, I gotta feed the dog when I'm done. Then just let it slide. So then when you're having sex, if you're used to meditating, a little thought will pop up, oh, that hurts. Instead of saying, oh God, that's going to ruin everything. Here we go again. I'm never going to have great sex ever again. Blah, 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 blah. Then you just like, oh yeah, it hurts, but whatever. Let's push it to the side and keep enjoying the moment. Having that ability to be in the moment and to be genital focused is really helpful for people in chronic pain.
What if the pain gets in the way of enjoyment?
Then some people, they're just going to put off sex, or they're just going to focus on their partner while they work on as hard as they can to help get the pain to go down. You can take endless amounts of opioids to get the pain to go away, but the problem with opioids is that they decrease the testosterone. There's often a trade-off. Getting with a physician that's an expert in pain management is probably important, involving sexual therapists, pelvic floor therapists, especially if you have spinal problems or chronic back pain. Very, very important to involve the whole team to be able to get you to your best ability to tolerate and live with pain and not have your negative thought process get in the way of things. There's going to be some people where it's still going to interfere. There's some people we don't have an answer for, but there's a lot of people that just assumed that and never got involved in that team process with a pain management doctor. There are injections people can have in their spine that will block nerves, so that you can probably get a nerve block that's a pain nerve, and it's not the same nerve as sensation nerves. There are lots of things that can be done to help get rid of pain in the genital area.
And what is the point where they could benefit from acupuncture versus maybe go to a breakthrough therapist?
For acupuncture for sexual dysfunction, we mostly just try to balance the energy in the sexual organs and the sexual meridians. For pain, we use the meridian that is where the pain is located. If you got an elbow pain, it's going to be this meridian here, or perhaps this meridian here that goes through. And so we treat those meridians. And then we use the ear. There's all kinds of central midbrain pain pathway areas that you can do acupuncture on to help the brain receive less pain. If we can manage the pain properly, then the pain goes down from like an 8 to a 2, and then you can have sex with a pain of 2. I mean, it's just there. It's there in the background. It's ignorable. It's pushed in the background. Just like you can have sex with the TV blasting some political ad. It can be distracting. You might start focusing on it, or you might just say, oh yeah, it's a political ad, and let me turn my focus back in. So the goal would be to get people's pain perception down to the point that they have pain, they recognize they have pain, they don't obsess about the fact that they have pain, but they can put it to the side. That varies person by person. I've met people who have between 7 and 10 pain all the time, and they're like, yeah, at least when it's a 7, I can put it to the side, and I don't want any drugs because I can get to a 7 just by telling my mind not to pay attention to it. And I'm like, wow, good for you. But, different people have different levels where things interfere. And we haven't figured out what makes people rate pain a certain way, what makes people able to take their brain off just a little bit. We know that guys evolutionarily have been the people that have been, go out and kill the lion and bring it home for dinner. They seem to have if I've got a mission I'm focused on, then I can push the pain to the side. Women seem to have, and there's receptors and neurotransmitters that go along with these things in parts of the brain. And I saw this at a conference once, in a pain conference, and I was fascinated. They said women have the ability to kind of turn off incoming interfering signals, like having a bunch of kids going, mommy, 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 and you're like, I'm talking to this adult here, shut up, kids. We seem to have innate biological ability to say shut up to multiple incoming distracting signals and be able to focus on a relationship, especially, or a conversation, that kind of thing. That's how we can better take our minds off the pain, is that it might be a signal from your foot, and one from your back, and then one from your head. You can teach people that, and they will usually giggle like I just did and say, yeah, it's kind of, I have done that. And then they know that that's a skill in their toolbox, and they can be confident about it. A lot of pain and suffering has to do with your viewpoint, your reaction to the physical experience of what you have and what you're going to do with that information right now. Worrying about the future, regrets about the past versus living in the moment, and whether you exaggerate that experience or whether you minimize that experience makes a difference in your ability to cope and function in life, including sexual function.
A big thing on working with pain is working with the panic. Even when treatment is starting to work with going to a doctor, pay for a therapist, getting hormone treatment, whatever that is, the panic of, but it's going to hurt. You need to retrain the body to relax. It's not even sensing the pain anymore. It's sensing in fear of the pain.
Right, exactly. Yeah, that's a good point. And relaxation is one of the things we also target with acupuncture, yoga, and meditation. The hypnosis especially, I'm really excited about this because you can give somebody a trigger word. Just hearing that word will put them in a state of deep relaxation super instantly. And just, of course, you don't want a word that's more obscure, and then you would give that as a gift to the patient and their sexual partner so that they can use the word. The person can be in a trance, having less pain, having less fear, and yet still able to experience sexual pleasure, because you can set it up that way. The mind is a very powerful thing, and the automatic nervous system part of the mind is even more powerful than we really think about or we give credit to. When you can access that subconscious or that unconscious part of the mind and say, you are allowed to not give this signal of warning. In fact, right now, let me just give you a hint. That's not very helpful or functional right now. I know you were trying hard and was good at one point, and thank you very much. I really needed that then, but I don't need that now. That's the kind of conversation that you have in hypnosis with the person's unconscious mind. You might even give them another outlet. You might say, thank you, Ms. Unconscious Mind, for the pain cue of not wanting to have that bad outcome before happen again. But what I'd really rather you do is, if you feel like you need to signal me to pay attention and be careful and not get injured, would you kindly give me an itch on the inside of my pinky finger or my right pinky finger? And so it can switch from pain to itch somewhere else, because it just wants you to know to pay attention to something that you're just so busy you're not paying attention to. I've seen this happen. Somebody grinded their teeth at night, and the person's like, they gave that cue, make your finger itch instead of grind your teeth. If you're trying to tell us something important in life that you're putting up with that you need to change is happening, I'm going to give you a physical signal, and it's not one that's helping. Especially sleep disturbance is not going to help someone move in a direction of positivity in their life. Now, I was saying a lot of times grinding teeth is stress related, and migraines can be stress related. A lot of things that are painful or disturbing can be stress related, and the person just is saying, no, I've got a handle on it, I've got a handle on it, and the body's trying to say, no, you don't. Fix something, talk about something, but here's your cue right here. Tightening of the vagina or whatever the case may be. So much stress that the person can't get it up, having soft erections or whatnot. Sometimes the body's just signaling you, get this bigger thing in life figured out. Don't keep shoving it to the side. Don't keep shoving it down. You need to address this, and I'm going to make you address it. That's where therapy is really helpful in that circumstance. Really.
I had one client. One day she just came and owned her own business. She started talking about something. I started seeing there was something different in her mouth every time she would talk about work stuff. It ended up being that she needed to fire someone, and she was procrastinating because she really didn't want to do it. She did it and it was gone. Like, she didn't do it anymore. It was just for that particular time that her mind was saying, you need to get this done. Like,
yeah. And if you continue to ignore it, like I did when I was in an adverse work situation, and I just had migraines, and then after a while I had migraines and poor sleep. After a while I had migraines and poor sleep and an elbow pain. And it was just pretty tough. And I guess I was ignoring a lot of signals. Then you stop and all this stuff starts going away. And the upset stomach or ringing in the ears. There's so many things. I think my brain was in total inflammation mode. And when I was able to do the self-care for 3 months straight with no additional responsibilities, it just better, super fast. Well, that's scary, leaving a job to not have another job to take care of yourself. And not everybody has the financial means. I'm not saying everybody just quit your job if you have a stressful job, but I'm saying that you can make yourself suffer and stay in a place where you don't need to be, if your body's giving you lots of physical signals that that's necessary to change, and you're too cautious to change, then seek therapy, seek job alternatives, start having a plan. It's going to help physical problems.
Can you find a pocket of time? Can you find 1 minute? Set your alarm. You can take 1 minute out of your day to just pause and breathe and relax your body and then go back in. Yeah, I get it. You can quit your job, but you can go to the bathroom and drink water. You can't pause. The world's not going to end.
Yeah.
And if it is, maybe you do need another job.
And they told us as doctors, because doctors are the worst, I admit that if you do nothing else, you have to wash your hands before seeing another patient. You have to open the door to go into the room to see the patient. You can pause the 20 seconds you have to anyway to wash your hands, to be in the moment when you're washing your hands. You can pause with your hand on the doorknob and wait before you go in the room and just take a breath. This is true in other professions. If you have a client meeting, you can give yourself 5 minutes beforehand to breathe, to organize your thoughts. You can do self-care. You can walk the dog. You got to walk the dog anyway, so you can walk the dog a little further if you need exercise. There's ways to incorporate things that are tied to things you need to do anyway. In fact, that's one of the most effective ways to have a resolution that you have about your health, and then to make it reality, in addition to using some kind of format to make sure it's a good resolution. SMART goal technique: specific, measurable, action oriented or attainable, relevant, and time limited. That's one technique, but the other technique is to tie it to things that you need to do anyway to start a new habit. I'm going to go for a walk. I'm going to put my tennis shoes by the dog leash. I got to take the dog out anyway. At least I'm going to put my tennis shoes on and take the dog out. Whether I do the walk or not, I'm 2/3 of the way there. These are ideas that are really good for making changes.
Habit stacking and applauding myself out loud are the things that are working for me. Like when I put my keys where they go, I'm like, look at me, I put the keys where they go. And I celebrate it out loud so I can continuously mark that moment and make it a thing that was done and highlight it. The last time I talked about it, I lost my key the same day because I put them where they don't go. But it definitely does help. I'm gonna give you 3 in 1. Can acupuncture help with hormonal balances? What do you think Eastern medicine brings to the table that maybe Western medicine was missing? And can you tell us who you are, what you do? How do we know that we should see you?
Acupuncture can help with hormone balance. I was recently at a conference and a gentleman put up his exact protocol of what he does for estrogen increase, estrogen decrease, progesterone increase, progesterone decrease, testosterone increase, testosterone decrease. I'm doing for a friend right now, I am doing the estrogen, progesterone, and testosterone increases. Wrote them all out, all the points. I found out which ones are overlap points so I don't have to do them twice. We have a protocol that we're running right now in the office. Fingers crossed, I'd love to see it work. We're halfway through that. But I didn't even know that that existed. I knew that we could help people conceive because when people are having trouble conceiving and you use acupuncture a certain way, then you can help some people conceive. Part of it is taking the stress hormones out and boosting some of the other hormones. So yeah, there's a lot of ways that acupuncture can manipulate the hormone system and the inflammation system, which is inhibiting the hormone system. That's one. Second, Eastern medicine, what does it have that Western medicine is missing? It's more the wave theory, and the understanding of energy in the body is a big thing that Western medicine is missing. The structure of how you deliver Eastern medicine is typically in a longer time frame and is very keyed in on listening to the patient. Western medicine had that at one point in time, but as business has taken over Western medicine, it has lost that. The old-fashioned doctor that came in the buggy to your house and sat with your family while the person had pneumonia and was dying, and you gave them 24 eggs these days, that's a good deal. That has gone away. And you got the 8 to 15 minute visits and get your insurance pre-authorization first, which kind of like, let's fill out the boxes on the computer. And it just really, unfortunately, primary care anyway has gone in that direction. A lot of doctors are leaving because they hate it, like me. When you have a direct primary care office and you're getting paid directly by the patient, you can take that hour. That part of Western medicine is coming back in small chunks in small places, concierge medicine as well. But Eastern medicine, generally speaking, has the time to sit down with the patient, time to hear the whole story, time to delve into the things that are behind the problem. It's got a better handle on that right now in this business climate than Western medicine does. As far as who I am, I'm Dr. Victoria Menold. I'm a board-certified family medicine physician and practiced for over 25 years in Western medicine. I've done Eastern medicine in the form of ear acupuncture at the VA since 2017, developed the medical acupuncture in 2023 into 2024. Opened my medical practice in August of 2024. It's called West East Primary Care and Acupuncture. We combine West and East techniques for the best of your primary care, or we can do acupuncture with a little bit of Western science understanding behind it, so that people that are kind of like, ooh, acupuncture, that's woo-woo. What is that? Magic? No, we can explain it. That's helpful. I'm really interested in helping people that are afraid of needles understand that there are ways to do acupuncture that don't involve needles. You can get the fear of that out of the way. That's what I do. I'm located in Odessa, halfway between Gun Highway and the Sun Coast, or Veterans, however you want to look at 589. I'm on Route 54, just off of it on a little loop called Upton Loop. You can contact me, 813-553-1880, and or you can use my webpage, which is www.
Thank you, Dr. Menold, for being with us today. I would love next time to talk more about the needles. My husband is like, that's nothing for him. If you draw blood, he will have a physical reaction. You can see his belly just going crazy. It's a whole thing for him. But I'm very interested in how can we use acupressure maybe on ourselves. Sometimes when I teach yoga, I'm like, okay, let's give ourselves a little massage. Since I'm teaching older population now.
A whole session where I can show some acupressure points and explain the ways that we can do things without needles. I want to let you know that things can change, because I was one of those people where I saw a drop of blood when I was a kid and I got grossed out. I watched the Dracula movie and I had to leave with nausea. My first day of medical school in surgery. They were doing breast surgery. I guess that felt personal to me. And I smelled the burnt flesh from the coagulation machine and fainted. They're like, maybe medical school's not right for you. And I'm like, oh no, it's going to work. I already paid for it. Even the acupuncture school, the first time I stuck a needle in myself and had to watch it go in, I had to sit on the floor and lift my legs up. But, it can be overcomable. You can either reinforce it and say, oh my God, I'm scared, I can't do this. Or you can say, I'm going to overcome this. There's ways around it.
That's good. Yeah, I would definitely be someone. I'm happy to stick it myself. I don't care. I learned how to use needles very young. We had a person being taken care of the heart cancer at home, so I learned that you switch the thing for fluids or whatever.
You grew up with it. It was not threatening to you, whereas most kids grow up with that once a year poke in the doctor's office for their vaccinations or multiple pokes. And then they remember that very strongly and they take it with them and they have that little trauma and then it exaggerates because they don't have other experiences with needles that are positive. Yeah, after a certain period of time, you can have a lot of positive experiences with needles and you can lose some of that fear. I really appreciate the opportunity to talk with you.
Thank you. Thank you for taking the time and I'll see you around.
Okay, see you around.